The medulla oblongata is a conical part which extends between the spinal cord and pons. It is also known as bulb. Anteriorly, it is related to the clivus and meninges. Posteriorly, it is related to the vallicula of the cerebellum. It occupies infratentorial region. The piriform or the bulb-like in shape. It is 2.5 to 3 centimeters in length. The anterior surface shows anterior-median fissure separating pyramids. The anterolateral sulcus separates pyramids from the olive. The pyramidal elevation contains pyramidal fibers which decussate with the rows of the opposite side, that is the pyramidal decussation. Here in this diagram you can see the medulla oblongata. Here this is conical. This is showing the anterior median fissure which shows the pyramidal decussation. This is the pyramids. This is the olive. Here is the anterolateral sulcus. This is the posterolateral sulcus. The olivary elevation is due to the underlying inferior olivary nucleus. The anterolateral sulcus lodges the rootlets of the hypoglossal nerve. Olivary elevation is separated by posterolateral sulcus from the posterior surface. From the posterolateral sulcus emerge the glossopharyngeal, vagus, and accessory nerves. Here, this diagram shows the anterior median fissure. The pyramid is the anterolateral sulcus giving origin to the hypoglossal nerve, and this is the posterolateral sulcus here, which gives emergence to the cerebral glossopharyngeal, to the vagus, the cranial, and the spinal part of the accessory nerve. The posterior surface lies behind the posterolateral sulcus. The upper part shows inferior cerebral peduncle on both sides. It forms lower part of the fourth ventricle. The upper part depicts transversely running striae medullaris. The lower part shows the gracile tubercle medially and cuneate tubercle laterally. Here in this diagram you can see the transversely running fibers, that is the striae medullaris. This is the posterior median sulcus. Here laterally you can see the inferior cerebral peduncles. Then here it is the gracile tubercle with the gracilis fasciculus gracilis. This is the cuneate tubercle with the fasciculus cuneatus. Now, the structure of the medulla oblongata is studied into three sections: the lower, middle, and the upper. The At the caudal closed part of the medulla oblongata, the transverse section resembles the spinal cord in having the same three spinal white columns and tracts. White matter shows decussation of pyramidal tract. 80% fibers cross, while 20% fibers remain uncrossed. Rest of the features of the white matter remain same. Here, this is the spinal cord, and this is the, you can see the medulla oblongata, the lower part of it is almost similar. Tracks are almost similar. At the transition from, so here you can see the transition from the spinal cord to the medulla. The pattern of the gray and white matter undergoes considerable rearrangement. The ventral horn becomes attenuated here. The dorsal horn is also replaced by the caudal part of the trigeminal sensory nucleus, the nucleus of the spinal tract of the trigeminal nerve. Here you can see the formation of the nucleus of the trigeminal spinal tract of the trigeminal nerve. The sensory nucleus of the trigeminal nerve here. This is a very long nucleus extending in whole of the brain stem. The trigeminal sensory nucleus is regarded as the brainstem homologue of the dorsal horn since it receives primary afferent fibers conveying general sensation from the head, which enters the brainstem in the trigeminal nerve. It is a large nucleus that expands the whole length of the brainstem and into the upper segment of the spinal cord. This latter caudal part of the trigeminal nucleus is particularly associated with the modalities of the pain and temperature. The spinal tract of the trigeminal nerve. Here, this is the median section of the medulla oblongata. We can examine it from the medial aspect. The trigeminal nerve, as you can see over here, it is attached to the pons. The fibers that terminate in the part of the trigeminal nucleus caudal to this level descend in the tract, that is the spinal tract of the trigeminal nerve, which lies immediately superficial to the nucleus. Here you can very well see the trigeminal sensory nucleus, and adjacent to it, just lying laterally, is the spinal tract of the trigeminal nerve. The lateral funicular shows dorsal and ventral spinocerebellar tracts, lateral spinothalamic, rubrospinal, and reticulospinal tracts. The anterior funiculus contains anterior corticospinal tract, the anterior spinothalamic tract, the tectospinal tract, vestibulospinal, olivospinal, and the reticulospinal tracts. Decussation of the pyramids. Here you can see the pyramidal elevation. These pyramids they descend here. They cross in the lower part here, and then they form the lateral corticospinal tract. The unclasped fibers they descend down as anterior corticospinal tract. In the ventral medulla, the majority of the fibers of the pyramid undergo decussation, then pass laterally, dorsally, and caudally to form the lateral corticospinal tract. You can see the decussation. Here you can see the pyramids, and here you can see the decussation. Here is the pyramid, here is the decussation. In this diagrammatic transfer section, you can see the fibers of the pyramid they cross to the opposite side, forming the lateral corticospinal tract. The rest of the tracts, as you can see over here, they remain the same. The decussating pyramidal fibers separate the anterior horn from the central gray matter. The separated anterior horn forms the spinal nucleus of the accessory nerve dorsomedially and supraspinal nucleus for the motor fibers of the first cervical nerve medially. Central gray matter with the central canal is shifted posteriorly because of the decussation, and the lower end of the nucleus gracilis appears. Substantia gelatinosa is continuous with the lower end of the nucleus of the spinal tract of the trigeminal, and fibers of the tract itself are interposed between the nucleus and the surface of the medulla oblongata. Then transverse section at the sensory decussation. It occurs at the middle part. Decussation of the internal arcuate fibers is seen. The fibers from the nucleus gracilis and nucleus cuneatus intercross, so that the most medial fibers from the feet and leg come to lie most anteriorly in the medial lemniscus. These are followed by fibers from the trunk and upper limbs in that order, with the head posteriorly. This is the tiers of the medulla oblongata. You can see the nucleus gracilis, nucleus cuneatus. This is the internal arcuate fibers, the second order neurons. They cross in the midline and ascend up as medial lemniscus. The ventral surface here you can see the nucleus gracilis, the nucleus cuneatus, the fasciculus gracilis, fasciculus cuneatus. This is the internal arcuate fibers. This is the central gray matter. Here, these are pyramids, and this is the medial lemniscus. On the ventral surface of the mid-medulla, the pyramids are prominent above their decussation. The pyramidal tracts lie anteriorly. The medial longitudinal fasciculus forms a small compact tract situated close to the median plane, posterior to the medial lemniscus, connecting third, fourth, sixth, eighth, and 11th cranial nuclei. The spinocerebellar, lateral spinothalamic, and extrapyramidal tracts lie in anterolateral area. The nucleus gracilis and nucleus cuneatus are separated from the central gray matter. The fasciculus gracilis and cuneatus terminate here and internal arcuate fibers arise. Here you can see the nucleus gracilis and fasciculus gracilis, nucleus cuneatus and fasciculus cuneatus, central gray matter, the internal arcuate fibers, the medial lemniscus. The dorsal surface. On the dorsal surface, the dorsal column each reach their termination in the gracile and the cuneate nuclei, which appear beneath their respective tracts. Here you can see. the nucleus gracilis and the fasciculus gracilis. Similarly, you can see here the nucleus cuneatus and fasciculus cuneatus. The dorsal column consists of first order sensory neurons. The cell bodies of these neurons lie in the dorsal root ganglion of the spinal nerve and have central processes that are ascended. Medial lemniscus. The axons of these neurons they course ventrally and medially as internal arcuate fibers decussating in the midline here. You can see the decussates. Thereafter, they turn rostrally, forming a distinct tract, the medial lemniscus, that runs through the rostral medulla, the pons, and the midbrain to terminate in the ventral posterior nucleus of the thalamus. Lemniscus means ribbon-like. Here you can see the course of the fasciculus gracilis and cuneatus. Their first order neurons they lie in the dorsal root of the spinal nerves. They ascend up as fasciculus gracilis and cuneatus, reach to the acrolelia in the nucleus gracilis and cuneatus. The first order neurons, second order neurons, they arise from the nucleus gracilis and cuneatus, forming the decussation. There is the internal arcuate fibers that decussate here, and after decussation, they ascend up as medial lemniscus through the pons and midbrain to reach to the thalamus, ventral posterolateral nucleus. And from here, you can see the thalamic radiations they pass to the somatic sensory area of the cerebral cortex. The accessory ciliate nucleus represents displaced pontine nuclei and give origin to posterior external arcuate fibers. The external arcuate fibers enter the cerebellum through ipsilateral inferior cerebral peduncle. The accessory ciliate nucleus receives the afferents from the lateral fibers in the fasciculus cuneatus derived from the cervical segments. It provides pathway the cunocerebral tract for proprioceptive impulses from the upper limb destined for the cerebellum. The nucleus of the spinal tract of the trigeminal nerve at this level is separated from the central gray matter by internal arcuate fibers. The fibers of the trigeminal nerve terminate here. A part of the inferior alveolar nucleus is visible. The central gray matter is markedly reduced in size and contains three nuclei: the hypoglossal, dorsal nucleus of the vagus, and the nucleus tractus solitarius of the glossopharyngeal nerve. The nucleus tractus solitarius receives gustatory efferents from the facial, glossopharyngeal, and vagus nerves. The numerous islets of the grey matter occur in the center of the ventral portion of the medulla oblongata. They occupy an area which is freely intersected by nerve fibers running in all directions and therefore termed reticular formation. Now, coming to the transverse section at the floor of the fourth ventricle, the anterior external arcuate fibers arise from arcuate nuclei and pass to the opposite cerebral hemisphere through inferior cerebral peduncles. Extramedullaris arise from the opposite arcuate nucleus and pass dorsally through substance of the medulla oblongata to reach the floor of the fourth ventricle. They run under the ependyma to inferior cerebral peduncle of opposite side. On the ventral surface you see the bulge, this is the olivary nucleus. Here you can see the medial lemniscus, the medial longitudinal bundle. This is the central gray matter here. The inferior cerebral peduncle you can see. On the ventral surface of the medulla, the pyramids remain conspicuous here. Immediately dorsal to the pyramids, you find here the dorsal lateral to the pyramids and lateral to the medial lemniscus is the inferior olivary nucleus. This one lying within the prominence of the olive. Let us say the inferior olivary nucleus. The inferior olivary nucleus has the appearance of a crenated bag with opening at the hilum facing medially through which afferent and efferent fibers they pass. So this is the inferior olivary nucleus is purse-like, this is the hilum. The, it is concerned with the control of the movements and receives afferents from the motor and sensitive cortexes of the cerebral hemisphere and from the red nucleus of the midbrain. Here you can see the cortico-olivary cerebral fibers coming from the cerebral cortex and from the to the cerebellum and from there coming to the inferior olivary. Then from the red nucleus you can see the proprioception coming to the medulla oblongata and inferior olivary nucleus. Its main efference connection is to the cerebellum by the inferior cerebral peduncle. This is it. From the inferior olivary nucleus, it goes to the cerebellum. Within the cerebellum, its axons known as climbing fibers. In the excitatory synapses, in the dentate nucleus, and upon Purkinje cells of the cerebral cortex. Close to the inferior olivary nucleus lies medial and dorsal olivary nuclei. They give rise to para-alveolar fibers going to the opposite cerebellum. Arcuate nuclei form interrupted bands of gray matter closely applied to the anterior and medial aspect of the pyramidal tract. These represent the displaced pontine nuclei. They give rise to anterior external arcuate fibers, striamedullaris, both passing to the opposite cerebellum. Let us see the floor of the fourth ventricle and see the nuclei of the cranial nerves. The dorsal to the inferior alveolar nucleus and lateral to the medial lemniscus lie the second order sensory fibers ascending to the ventral posterior thalamus. They these fibers come from the trigeminal nucleus, the that is a trigeminal thalamic tract, and from the spinal cord, that is the spinothalamic fibers referred to in the brainstem as the spinal lemniscus. The spinal tract of the trigeminal nerve. Here you can see lying lateral to the sensory nucleus. Let us come to the hypoglossal nucleus. The dorsal surface of the rostral medulla forms part of the floor of the fourth ventricle, both immediately and, and deep beneath the floor of the ventricle lie a number of cranial nerve nuclei, some of which can be clearly identified in simply stained sections, others of which cannot be identified. Here you can very well recognize this hypoglossal nucleus, the floor. The hypoglossal nucleus. Here is the vagus nucleus. Immediately beneath the ventricular fold, just lateral to the midline, lies the hypoglossal nucleus, which contains motor neurons innervating the muscles of the tongue via the hypoglossal nerve. Let us see the vagus nucleus that's lying lateral to the hypoglossal nucleus. Lateral to the hypoglossal nucleus lies the dorsal nucleus of the vagus, containing preganglionic parasympathetic neurons that run in the vagus nerve. Here in the floor, we can see here the vagus nerve nucleus lying lateral to the hypoglossal. The hypoglossal, the vagus. The most caudal aspect of the ventricular floor is known as the area prostima. This one. At this area prostima, the blood-brain barrier, which limits the passage of the certain chemicals from the blood to the brain, is absent. This region is the central site of action of substances that cause vomiting, that is the emetics. In the lateral part of the floor of the fourth ventricle are located the vestibular nuclei, which receive primary afferent fibers from the vestibular nerve. Here you can see the vestibular nuclei present in the floor of the fourth ventricle. The medial longitudinal fasciculus. Here we can see the medial longitudinal fasciculus. So ventromedial to the hypoglossal nucleus, close to the midline, is the located the medial longitudinal fasciculus. This medial longitudinal fasciculus consists of both ascending and descending fibers and can be identified also in the pons and the midbrain. So this is the ascending fibers coming and going to the midbrain and connecting with the uh, fourth and the third nerve here. Lower down it is connecting descending fibers going to the lower part of the medulla. Within the brain stem, it links the vestibular nuclei with the nuclei supplying the extraocular muscles, that is abducent, trochlear, and oculomotor nuclei, and observe the coordination of the head and eye movement. Here you can see the vestibular nuclei, and they are connecting to the medial angular bundle with the third, fourth, the sixth nerve. Then coming to the restiform body are the inferior cerebral peduncle. This one, you can see the inferior cerebral peduncle. The dorsolateral part of the rostral medulla is dominated by the inferior cerebral peduncle or the restiform body. This consists of fibers passing between the medulla and the cerebellum. Here you can see the restiform body. The prominent among these fibers are the oliocerebral fibers connecting that is the connections between the vestibular nuclei and the cerebellum and the fibers of the dorsal spinocerebellar tract conveying proprioceptive information from the limbs. Here you can see the connections fibers going to the inferior cerebral peduncle. Yeah, you can very well appreciate the fibers going to the cerebellum, including the inferior cerebral peduncle. That is a cochlear and ambiguous nuclei. Here we can see the dorsal and ventral cochlear nuclei present in the floor of the fourth ventricle. On the dorsal and the lateral aspect of the inferior cerebral peduncle lie the dorsal and ventral cochlear nuclei, which receive afferent from the information from the cochlear nerve. Deep beneath the ventricular floor, just dorsal to the inferior olivary nucleus, is located the nucleus ambiguous. This sends motor information to glysopharyngeal, vagus, and accessory nerves, and thence to the muscles of the pharynx and larynx. So you can see here the nucleus ambiguous. In this transverse section through the upper part of the medulla oblongata, you can see the inferior cerebral peduncle, the floor, you can see the hypoglossal nucleus, the vagus nerve nucleus, the nucleus tractus solitarius, the nucleus ambiguous, this is the medial longitudinal bundle, this is the medial lemniscus, and these are the fibers of the on the inferior olivary nucleus going to the inferior cerebral peduncle. The reticular formation. It contains well-defined centers of regulation of muscle tone and activities of the vital viscera. These visceral centers are respiratory center, cardiac center, concerned with the regulation of the heart rate, and vasomotor center for the regulation of the blood pressure. Coming to the blood supply, the medulla oblongata is supplied by branches of the vertebral artery. The anterior spinal arteries they supply a triangular area next to the midline, which includes pyramids and medial lemniscus. The posterior spinal arteries supply a small area including brachii and junior tubercles. The posterior inferior cerebral arteries they supply the region behind the olivary nucleus, which includes the spinothalamic tract, nucleus ambiguous, and the dorsal nucleus of the vagus. The posterior inferior cerebral artery also supplies descending autonomic fibers and part of the inferior cerebral peduncle. The rest of the medulla is supplied by direct bulbar branches of the vertebral artery. The veins from the medulla drain into the superior and inferior petrosal sinuses and transverse sinus. Below these veins are continuous with the veins of the spinal cord. In this diagram, you can see the various parts of the medulla oblongata supplied by the arteries. You can see the region here supplied by the posterior inferior cerebral artery. This is the region which is supplied by the anterior spinal artery. Applied it. The thrombosis of posterior inferior cerebral artery produces lateral medullary syndrome or Wallenberg syndrome, which leads to, on the site of the lesion, vertigo, vomiting, and nystagmus because of the vestibular involvement, ataxia of the limbs because of the inferior cerebral peduncle involvement, loss of pain and temperature sensation from the face, and loss of corneal reflex because of the spinal tract of the trigeminal nerve, Horner syndrome because of the involvement of descending sympathetic fibers, dysphagia and hoarseness, that is involvement of nucleus ambiguous. On the opposite side of the lesion, you will find loss of pain and temperature sensation from the trunk and limbs, that is lateral spinothalamic tract involvement. Here you can see the area this of the involvement because of the infarction, because of the posterior inferior cerebral artery. The region involved it consists of vestibular area, the inferior cerebral peduncle, the spinal tract of the trigeminal nucleus, the nucleus ambiguous, the sympathetic tract, and the spinothalamic tract. Then thrombosis of the anterior spinal artery leads to the medial medullary syndrome. The patient presents with the contralateral hemiplegia to the damage of the pyramids, ipsilateral wasting of the muscles of the tongue, that is the hypoglossal nucleus involvement, and contralateral loss of position sense in the limbs because of the involvement of medial lemniscus. Here you can see the involvement of the pyramids, the medial lemniscus, and the hypoglossal nerve. Here in this diagram, you can see the loss of pain and temperature sensation. You can see the wasting of the muscle of the tongue. Then injury of the lower part of the medulla oblongata. It is easily fatal because of the vital centers that is the respiratory and vasomotor center. They are situated in the lower part of the floor of the fourth ventricle formed by the medulla. Palsy. Patient presents with the weakness of the muscles supplied by the facial, glossopharyngeal, vagus, accessory, and hypoglossal nerves. That is, the muscles of the facial expression, pharynx, tongue, palate, and pharynx. Lesion is the lower motor neuron type. Patient presents with the difficulty in speaking and swallowing, having expressionless face. Pseudobulbar palsy. It occurs due to the bilateral lesion of the corticonuclear fibers. There is paralysis of the muscles of the tongue, lip, pharynx, and palate. The cause of the pseudobulbar palsy may be vascular infarction, syringomyelia, and increased intracranial pressure. Development. The medulla oblongata develops from the caudal mesencephaly part of the robencephalin vesicle. The neuroblast from the alar plate of the neural tube at this level will produce the sensory nuclei of the medulla. The basal plate neuroblast will give rise to the motor nuclei. Here you can see the sulcus limitans separating the alar plate of the neural tube from the basal lamina, which is the medulla oblongata. You can see the development of the sensory nuclei and the motor nuclei. Sensory nuclei in the alar lamina and motor nuclei in the basal. These are the these seen on the posterior aspect of the floor of the fourth ventricle. You can see the sensory nuclei. You can see here the motor nuclei. So that is all about the medulla oblongata, its applied anatomy,